welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Henry Herrera. He's a gastroenterologist and he wrote the Kevin MD article, What's to Blame for the Obesity Epidemic? It got 7,000 shares on social media, so it really resonated. So we'll talk about that in a bit. But first, Henry, welcome to the show.
Thanks, Dr. Poe. I appreciate it. Thanks for having me on here.
All right. I was wondering if you could share your story and your journey to where you are today.
Yeah, thanks, bud. So, I'm originally from an area of Texas called the Rio Grande Valley, which is deep, deep South Texas. Most people think of South Texas as San Antonio and Houston. Well, so I'm about 4 hours or so south of San Antonio, and I actually live about 10, 15 miles from the border of Mexico. So we're really, really deep south. I was raised in this area in McAllen, Texas. I did my undergrad in this area, and then I moved to Dallas to do my medical school at Southwestern. Did my residency at Southwestern in internal medicine, and then I did my fellowship in gastroenterology at Scott and White, which is in Temple, Texas, about an hour north of Austin or so. Leaving Dallas, I actually thought that I was going to go right back to Dallas and practice there, but you start having kids, you raise a family, and things change. Once I lived in Temple, I kind of realized that my idea of what I wanted for my family and for my practice changed. And I started, talking to some gastroenterologists that were from my hometown, my home community, and it just felt like a perfect fit. So I've been at DHR Health gastroenterology for 4 years now. I've been very happy taking care of people here in my community, and it's just been great.
Fantastic. And how has the pandemic affected you and your practice?
Man, it's been tough. I mean, in one sense, I could say that I'm fortunate and blessed that it hasn't been hit to the extent that it's been hit in other areas, the major metropolitan areas that we all know about, New York City and here in Texas and Houston and Dallas is starting to get affected. But beginning about mid to late March is when we started to really feel the impact. And April was essentially kind of essentially just dead here in the clinic. We've had to really make some changes in terms of how we approach the practice, how we see patients. We've trended over towards telemedicine. April and May was almost 100% telemedicine visits. As a gastroenterologist, a lot of our practice also depends on endoscopy. And that was pretty much non-existent for about 6 weeks there. And it's understandable. I mean, nobody wanted to come out and take the risk of being infected and being in a healthcare setting. Nobody wanted to be close or take risk of getting the coronavirus. And so, for a while, we just did a lot of telemedicine visits, did consultations that way. But slowly, once we kind of reached that area where things were starting to seem like they were leveling off, patients started to trickle in a little bit more. Here the last week or so, things are kind of starting to slow down again. I imagine it's probably the same as it is with all the other practitioners throughout the country. It's just kind of one of those things. I mean, there's not a whole lot you can do about it. You can't blame the patients for not wanting to come in and take the risk. So, the best we can do is try to offer the best advice that we can, either on the phone or when they come in person, and just respect their decision to want to stay home.
So let's get to your article. You wrote the article, What's to Blame for the Obesity Epidemic? Now, you practice near McAllen, Texas, and that city jumped into the public consciousness from Atul Gawande's New Yorker article back in 2009, where it was the most expensive city for medical care before the Affordable Care Act. And reading your article, it was also named the fattest city in America, according to WalletHub. Now, that's a lot to overcome. So what's it really like to practice near McAllen, Texas?
So, part of the reason that I wrote the article was in a way because of that article written by Dr. Gawande. It's funny. A lot of the reason that we kind of make it into the public eye is for all the wrong reasons. It was back then it was for Medicare, and then now it's this obesity pandemic, and then here recently we had this issue with chainsaw incident. But one of the reasons I wanted to just make it known is just to basically show that there are certainly things that we need to fix here in this area, but I also wanted to write an article and just show that there are some positives here in the region. And I kind of wanted to make a point to say that, yes, although WalletHub did name us the fattest city in America, we're not alone in it. and it's a universal issue, not just in South Texas, not just in Texas, but in the country. And so I just wanted to make a point when I wrote it that yeah, you know, you kind of have to own it, right? We would definitely have a lot of obesity in the area, and it contributes to a lot of medical problems that we have here. You know, I'm not a dietitian or a nutritionist, but as a gastroenterologist, a lot of the disease states that I see go hand in hand with diet. I mean, you talk about things as benign as, you know, acid reflux, gastritis, but then you think about things like symptomatic gallbladder disease. You think about pancreatitis. You think about even things like diarrhea, constipation, irritable bowel syndrome. I mean, you name it, almost every single disease process that I see in clinic, diet plays a major role. And so, you know, I thought it was important to raise awareness about obesity in this area. I think it's interesting that in the U.S. as well as here in the Valley, people have made strides to try to figure out what can we do to improve on the rates of obesity. And you know, every couple of weeks it seems there's a new diet trend. Different exercise equipment. There's CrossFits here everywhere. There's gyms everywhere. Pretty much every block you have something that you can do in terms of trying to improve your fitness. But yet we're seeing every year that the obesity rate continues to increase. And so there's something that we're not quite hitting. And you know, I kind of think that part of it is just it's the things that you do behind closed doors. It's the things that you do when you're by yourself that really play a huge role. And you know, I touched on it in the article. It's you know, going to the grocery store, and maybe instead of trying to, you know, go around in the parking lot looking for that spot at the very front, maybe just parking in the back, and it's, you know, an extra, you know, 300 or 400 yards that you have to walk each way. It's taking the elevator as opposed to just walking up the stairs. Here at the hospital, I kind of have a general rule, and the fellows that I work with know that I'm not doing the elevator, man. I'm going up the stairs unless it's 4 floors. That's kind of my limit. I go up the stairs everywhere I go, and I think it's important to do those small things. And I also talked about in the article that technology, to an extent, has been harming us, and especially in this pandemic. You know, I've got kids, and it's hard. It's hard not to feel guilty when, you know, your kids just want to be on the iPad all day, and you do what you can to try to get them out and exercise, but there's only so much that can be done, especially during the time when we were at the shelter at home. But you know, even during regular life before this whole pandemic hit, I think a lot of people are spending time on their phones, on their iPads, and the computer, and not so much time just being outside. Personally, I'm a huge outdoors person. I love being outside. I love, you know, jogging and exercising and those sorts of things. But I think, you know, you can only do so much in terms of, you know, creating, you know, restaurants that have healthy foods and gyms. I think the onus is on the person to do the things that it's just all the little things to help lose weight. And I think every calorie counts. I think if you do that over a period of a week, a period of a month, and you're consistent about it, I think the weight will improve. And with weight loss, you get improvements in all the other things that go along with it: hypertension, diabetes, you know, risk of heart disease, risk of stroke, all these things that kind of I touched on in the article.
Everything you said, I see myself in my practice. I am an internal medicine physician. I have a primary care practice up here in New Hampshire. Now, a lot of doctors are busy. We have a lot of bureaucratic requirements. Now we have all the issues related to the pandemic. What are some tips that you could share with your fellow clinicians on how we can counsel patients to address the obesity issue?
Yeah, so I think that, you know, as a clinician, one thing that I really wanted to make a point of here locally is I think that you have to approach it kind of in a multidisciplinary approach, I guess. So one thing that we did is we hired a GI dietitian to come on board with us. And, you know, I'm not sure how your practice is. I'm sure you're extremely busy, but for the most part, in private practice and even in academic medicine, it's really difficult for one practitioner to talk about, you know, whatever the chief complaint may be. And then also spend enough time and time that's worthwhile to speak about diet. I mean, a diet takes, you know, 30 to 60 minutes on its own. And so I think that one thing that I try to tell my patients is, listen, you know, these are the issues that you're coming in with. These are the things that we're going to do about it. But one thing that you may benefit from is a dietitian visit. You know, another thing is making sure that if they have things like diabetes, to try to refer them to a diabetes center. I just think that it's important to think about it in a multidisciplinary approach. And the other thing that I always try to tell my patients is to really try to break it down. I feel like every patient has their knack or their vice. It's some people at home, they're just, sitting around and they decide, well, let me just go grab a bag of chips. Or I'll just go grab a cookie. And then, an hour later, I'm just going to grab another cookie. Well, at the end of the day, you've eaten 5 or 6 cookies. Or some people think that eating or drinking sports drinks, Gatorade, Powerade, that those things are healthy because they see on the commercials that all the athletes are drinking Powerade, but yet they're not doing the exercise needed to burn the calories. And so it's explaining to them, what is it what's your knack? Is it sodas? Is it chips? Is it snacking? There's always something. And so once I find out what that something is, I tell them, okay, look, let's look this up. And sometimes I'll grab my phone and I'll say, look, I'm Googling this. A can of Coke is, 150 calories. How many Cokes do you drink? Well, doc, I drink, a Coke a day. Okay, a Coke a day, that's 150 calories. You multiply that by 7, that's, about, what are we talking about? 1,000 calories. You do that times a month, that's 4,000 calories. That's about a pound. And so you kind of try to break it down into those very, very just simple concepts and say, look, man, you don't have to do a whole lot. I'm not asking you to exercise 2 hours a day. All I'm asking you is to just avoid that Coke once a day and do everything else the same. And we'll see again, and we'll see how you've done. And if they've lost that 1 or 2 pounds, then I think you've gained their respect and you've kind of gained their trust in saying, okay, well, it's not that hard to lose a little bit of weight. And in a lot of these patients, NASH, for example, fatty liver disease, just a 5% weight loss will dramatically reduce their liver enzymes. You lose 10%, you can reduce and regress their level of fibrosis. So a lot of these things can go a long ways. And it's just, it's all the minor things. So I guess the take home would just be, don't focus on any major things. Focus on just the small details, things that seem like they would be simple for the patient to do. And I think that would make the patient feel like it's not something that's kind of an insurmountable, like impossible task.
Well, thank you for sharing that advice. Now, Dr. Gawande wrote that article about McAllen back in 2009. And have things improved over the interceding 11 years?
Yeah, so what's funny is he mentioned a couple of different hospitals that are here, and I think the hospitals that he mentioned are both still here. I do think that things have changed. Again, I'm speaking from being here for 4 years as a professional, and when I lived here when I was younger, I don't know that I really paid much attention to the way the healthcare system was, but I will say that one of the things that's changed here is that we now have a university that has a medical school and a residency program. And here recently, we now have gastroenterology fellowship. And so I think that's changed the culture here in the Valley quite a bit. That's actually another topic that I was thinking about writing about, because I think it goes back to the whole idea that the Valley tends to be in the public spotlight for all the wrong reasons, but yet, there's not a whole lot of talk about how culture is changing here in the Valley. We have a primarily Hispanic population, but now we have medical students, we have residents, we have fellows, we have all these specialists that are coming in that's really changing the face of this area. So I think that, with practitioners and physicians that come from different parts of the country, I think you have different ways to practice medicine. And so that type of management that Dr. Gawande alluded to back then, which included a lot of kind of overuse of labs, overuse of imaging to make a profit, I think all that's changing. And I personally don't see that, certainly not within our group. And I don't think that I see that as a whole in our hospital. I think things have changed. DHR Health is affiliated with UTRGV, and so we have all our residents and we have all our fellows and med students rounding. And so it's nice to see that this hospital has turned into a true academic institution.
And my final question: what's your take-home message for the Kevin MD audience?
What I would say to take home from all this is, obviously obesity is a major issue. right now everybody's so focused on the pandemics, the coronavirus, and then we have this whole social injustice thing that's going on, and obviously incredibly major issues that need to be addressed. But underlying all this stuff, we have obesity, and obesity can either get worse or better when you're stuck at home. You can either make those minor changes, or you tend to be more sedentary and things continue to progress. So I guess what I would say is focus on the small things that you can do. Kind of take a look at yourself and look at your day and be honest with yourself and say, okay, do I necessarily need to use the motorized wheelchair at the grocery store? Do I necessarily need to park at the very front? Do I really have to take the elevator? Can I take the stairs? It's those very minor things that make a huge change at the end of the day.
Wonderful. Thank you so much for sharing your insight. On the show, we have Henry Herrera. He's a gastroenterologist. He wrote the Kevin MD article, What's to Blame for the Obesity Epidemic? Henry, thank you for joining me on the show.
Thanks, brother. Appreciate it.